get so tired of hearing about how only wealthy, white, fit people use these wearables. And I'm like, maybe that's the case, but they hold such, Andy knows, I am so passionate that these wearables just unlock health in a way that when paired with proper care and knowledge changes the game on health.
Try to fix the current system or reimagine something new. Will healthcare ever serve consumers just like me and you? The power's in our hands, but every side's gotta come together. We want the newer generations to get something better. Until we flip the script and talk about what gets prevented. Until we see the changes permanent as if we meant it. Until healthcare is finally consumer-centered. We've got a lot to rap about.
Hey friends, welcome back to the leading podcast about how consumer health works. We spotlight how healthcare is being designed, marketed, and delivered from the consumer point of view, and profile leaders who are championing the move to preventive care. If you want to understand healthcare both as a builder or operator and as a consumer yourself, this is the place for you. Here's what's going down today. First up, we have the Flava of the week about the 1-year anniversary of the CMS Health Tech Ecosystem. What have the 800 participating organizations pledged to do to transform the patient experience, and what hope does it give us for a future where these innovations are implemented and normalized? I'll talk about that. Then we host our first consumer panel, where Zain and I are joined by a panel of health consumers and friends who discuss their experience with wearables. In the following months, we're going to be hosting more consumer panels like this, so we follow our own advice and center our conversation on the consumer's point of view. So stay tuned for more of those to come. I'm Jared Johnson. Let's get it.
Flava of the week.
On July 27th, CMS marked the 1-year anniversary of its health tech ecosystem with a live event that served as a progress check, celebration of partnerships, and preview of the next wave of ecosystem pledges from some of the 800 participating organizations. While the live event wasn't all business, they staged a mock funeral of the infamous new patient clipboard, complete with casket and eulogies. The achievement of an important set of milestones was full of acknowledgments to those who have made previously improbable progress possible. Here are a few things to remember about the initiative. This is a public-private ecosystem. It's a voluntary initiative that aligns CMS's infrastructure with private sector technology and delivery partners. CMS is aligning networks, identity, directories, and FHIR-based exchanges so many trusted tools can work across the same foundation. Patient access is the North Star. The aim is secure, consented access to complete health information while reducing repetitive forms and disconnected portals. Priorities include kill the clipboard, conversational AI, diabetes and obesity support, care navigation, electronic prior authorization, and more. And finally, the Medicare app library is the front door. It's a centralized directory that helps beneficiaries find vetted digital care options evaluated for security, evidence, usability, and equity. What's the consumer lens? CMS's vision includes 3 steps to transform the patient experience, spoken from the patient's own voice. First, can you help me gather all my records from every specialist and healthcare professional that I've seen into a personal vault to give me a whole person view of my health? Second, can you then please let me use that big picture for the next time I interact with any healthcare provider, including a QR code or a tap at a brick and mortar location? Or for the 99% of the time when I'm not at an in-person visit, can you provide a fully personalized, secure, virtual way to manage my health as it stands today? And then third, can I tie that big picture back to a more generalized AI-driven experience that I control, that considers all of the newest medical research and knowledge, and gives me reliable indicators of where my health is headed next, so I can help prevent disease and ultimately live a higher quality of life than I do today? That's a big thing. And yes, we've heard visions and promises like this before. Participants are saying that this ecosystem, however, is facilitating conversations and cooperation at a breathtaking speed compared to previous attempts. So politics aside, in order to drive transformation in these important areas, it's necessary to acknowledge the work that's going on in both the public and private sectors to accomplish a lot of the aims of providers, patient advocates, and health tech organizations to bring a connected experience to reality. I'm not sure if there's room for cynics anymore if we want to make real progress, because if we can come together as an industry to accomplish even a fraction of what's been committed by the participating organizations in the health tech ecosystem, we'll be taking bigger, faster strides toward the future that digital health has been promising for years. Let's acknowledge the work that's been done this past year to transform the patient experience and take the pledges seriously that participating organizations are continuing to make along the way. That's another way that we'll build the healthcare of tomorrow And that's the Flava of the week. All right, folks, let's get into the flow and let's welcome everyone to our very first consumer panel here. We are trying a new format and thrilled to have our panel here. We've got Zain, we've got several other guests here, and we're going to treat this as a bit of a panel discussion where everyone's going to have a voice. So let's keep on rocking and rolling here. I'm going to start with on the order I see you on screen. So let's have everyone introduce yourselves, and I'll give you this order real quick, but just quickly name, title, organization, and then your experience with wearables. So that can be what you're currently using, what you use them for, and we'll dive into a little bit more as we go about how well they're working for you and, just what works, what doesn't.
All right. Zain Ismail, co-host of the Healthcare Wrap podcast. I currently use a Fitbit just because that's where I started. And then also recently, through my biking, got onto a Garmin 1050 bike computer with a heart rate monitor. So I guess that's a wearable too. So Fitbit and Garmin are my two brands of choice right now.
Ellen Brown. I think we can end the chronic disease epidemic, but we've got to move further upstream in our health and not force everything into the downstream bucket of healthcare.
Come on now.
We got to figure out how to do that. So I am part of a number of different ventures. Probably the one I'm most well known for is the Food is Health Substack. I also have a day job, which is consulting, and also through a platform called Crusonia that Carter Williams and I are building or have built. But I think from a wearables perspective, so I've kind of advanced. I've tried basically every wearable at any given time. You can see me wearing more than my share. I've tried Oura Ultrahuman, Whoop, Sleep 8, Garmin, Apple, Sense8, NextSense, Oslo, like you kind of name it, I've done it. But what I've done now is I've honed in on the biometrics that really matter to me with my health and those that are my weakness. And I've integrated it all in with my health records. And I now just take device data and feed it into my own personal health agent that I've built. And so, and I've integrated it in with my nutrition. And so I take pictures of my food. It's created a library, all these fun things. And I build plans out just by saying, like, this is my week, this is that. And it kind of tells me every day what to do. And it adjusts for me when my life goes haywire, which is pretty much every other day.
So, Andy Beckman, I work for Garmin, been at Garmin a little over 18 years, mainly in sales roles. I currently lead our sales efforts for Americas for what a group inside Garmin called Garmin Health. And our mission is to find partners that want to utilize the data coming from our wearables to provide positive outcomes. So that could be employee health and wellness benefits. It could be insurance applications for dynamic underwriting. We do a ton of research and clinical trials space. We do a lot in chronic condition management, from diabetes, cardiometabolic, remote patient monitoring, digital therapeutics. We're working a lot within the gym and fitness space for personalized workouts and helping people to understand their users better. And we're also working in the military from a fitness assessment, fatigue management, as well as sickness care or sickness awareness. And then we also have an innovation kind of catch-all space, which probably the coolest application there is we're working with a company out of Australia that works with over-the-road trucking companies. Nice. And using the data coming from a Garmin and their app, it will actually alert the driver roughly, I believe, 8 minutes prior to them falling asleep to help avoid, bad injuries on the road. So, pretty interesting space. Excited to be here.
Hey, Hailey Minter. I sit on the marketing and growth team at Reperio Health. We are preventive care at home without the hiccups. So, an at-home preventive screening with virtual provider follow-up, and of course, no one in the waiting room coughing on you, which is definitely my favorite part. I obviously work professionally within health tech, but very passionate personally about healthcare and preventive care specifically. I stumbled upon wearables towards the end of my collegiate athletics career. So trying to navigate going from a cardio intense sport like rowing into more of a traditional weight room setting. So I found myself within the world of the Whoop just through my collegiate athletic program. I believe maybe the field hockey team or something. Another team on campus used it for, monitoring their daily activities. But I used it to transition from rowing to weightlifting, and that was really, really valuable for me. But in recent years have gotten more into running. I was using the Apple Watch for a little bit, had some inconsistencies that I'm sure we'll talk about later. But now I find myself wearing this neat Oura ring every single day. As a female, I want to have, fashionable wearables. And I think it's the first on the market that I've seen that it's easy to wear, but also very accurate. So have kind of touched here and there in the wearable worlds, but I think my personal experience is more from the athletic side of the data.
Thanks for having me, guys. I'm James Yurkovich. I'm on the faculty at the Buck Institute for Research on Aging in Novato, California, where I lead a research lab for applied systems bioAI. I'm also an adjunct professor at the University of Texas at Dallas, where I teach the world's first graduate level engineering course focused on data science and digital health systems, aimed at training the next generation of scientists and engineers in this new and developing field. Personally, I currently use quite a bit of different, I don't know if they're all technically wearables, but certainly digital health technologies. I wear Oura and Whoop. Oura mostly for sleep tracking and Whoop more for fitness and tracking workouts, this kind of stuff. I have an 8 Sleep. Like Ellen, I've tried pretty much everything out there, Pinoe, Neurable, Ultrahuman, all of these different kinds of things. Professionally, my research lab uses all of them. We're currently running an ARPA-H-funded clinical trial that uses Oura and Whoop and Stelo by Dexcom, continuous glucose monitor. In my course that I teach here at UT Dallas, we give Oura rings to all the students, and I teach them about AI and data science on the data that they collect on themselves, so that they can kind of tie into their own personal health and be a little more engaged and participate in what we do.
Fantastic. All right, and I'm Jared. I have hosted this show for 8 years, and I feel like my role in the industry is to bring the right people and ideas to the table, create the right thought leadership, the right relationships to make healthcare more preventive. So, trying to kind of be in the glue sometimes of bringing the right people together. I currently have an Oura Ring 4 and an Apple Watch. It's probably the SE2, I think. Don't quote me on that. But yeah, you have used Apple Watch for years, primarily for fitness tracking. Can't go to sleep without closing my rings. I did try out a Stelo CGM once to connect that to my Oura just to see what that was like. So that's probably where I'm at right now. A moderate user to use it for fitness and sleep and a few other things. So, okay. So the reason why we had everyone share that is because that sets the stage for kind of where we're coming from. And I want to try this next section of the panel by reading out a statement. And each of you, if you generally agree with the statement, then just raise your hand in the air and I'll call on one or two of us to share a thought on, why you raised your hand or didn't. And then we can just kind of go off of there. There's just a few different topics. I think a lot of these are things that we hear about wearables or have experienced ourselves is kind of where it's coming from. So first one, kind of the gimme one is, my wearable is useful in improving my health. So I'm going to give that a hand raise. So at a base level, I think that's definitely what I heard from everyone's experience. But does anyone want to just throw it out there? Like, what in general, if you're satisfied with that, with what you've tried now, has it changed over the years? Ellen, go for it.
Ellen, sounds like Ellen has lots to say
I
here.
got an answer. I think for me, what it's really helped me hone in on, because I took the time back in January to dump 15 years worth of health data and a really robust health data set into AI and really dig into where my weaknesses were. The wearable has really allowed me to focus on a much more day-to-day basis on what I can do to change levers that are really impacting my health. So for me personally, sleep is a real heart rate variability is a real vulnerability of mine because of the allostatic stress load. And as Andy noted, I've learned actually to, despite a really, really heavy stress load, to really lower my daily allostatic load. But heart rate variability is still a real Achilles heel. and deep sleep. But I wouldn't have known that without tracking that daily. Now, there are other wonderful things that it tells me every day, but I'm fine. Like VO2 max is like my superpower. That's a fun thing to track, but it's not imperative for my health.
How much education did it take you to get to that level of understanding? Hey, yeah, HRV versus VO2 max is the thing that I want to focus on.
Say probably wearing, Oura, sticking with an environment for some period of time, like if you're in the Garmin environment, if you're in the Oura environment, just learning those metrics and what really changes and what doesn't. Like body temperature fluctuates a lot for females. When you have that sort of anomaly hormonally, it helps you understand, but it takes you a good year of really reading that data. And then I think for me, the great unlock has been AI. Taking that data and putting it for myself into Claude. And I want to be really clear when it comes to health. I always say, please use paid Anthropic and don't just throw it into chat. Big difference in the quality of recommendations and granularity of health data if you're really looking at your health. So that's been the big unlock, because then it's like the decoder ring, because, everybody has their own algorithm, and that's great it's like going to the lab and getting reference range. They're like, well, but I'm towards the top or I'm towards the bottom. Like, what does that mean? You plug that in and that's just like, boom, blows your mind.
All right. Let's try another one here, because that was good. Okay. Next one is, my wearable is generally accurate. Kind of tricky, the word generally, right? We could go on that. Hailey, I felt like you were starting to go there maybe with the Apple Watch. Do you want to share your experience?
Yes. So I actually switched from using a Whoop to an Apple Watch to now the Oura due to the accuracy, and why I'm actually in the market for a Garmin, Andy. Getting into running within the past couple of years, obviously you're learning things as you go, from social media, from your peers, from the tools that you have at your disposal. And I found that there were small little discrepancies through everything that I was using. So when I was tracking through Whoop, it would be like a quarter mile off versus the Apple Watch. Same thing with the Oura Ring. I'm finding that there's a significant amount of discrepancies when it comes to tracking your workouts specifically. I think that there's a lot of inconsistencies with the measuring of heart rate data when it comes to wearing the ring when you're working out and things like that, versus, the Apple Watch was able to keep on your heart rate and workouts, and then the Whoop and so on. So I definitely think that when it comes to the accuracy, the Oura has been the closest, but it depends what you're tracking, right? When it comes to my sleep, like Ellen mentioned, my heart rate variability, things like the menstrual cycle tracking, I would go to Oura. But when it comes to things like fitness tracking and whatnot, I'm finding tools such as like the Apple Watch or the Garmin may be better fit for my use case. So I think it just comes down to, what are you trying to accomplish, and does the wearable have the specific tools built in to support that use case?
Awesome. And I would just add, from a more of a research perspective, to me, it's more about relative accuracy than absolute accuracy. So if we compare kind of all of the wearables that I would kind of view in the same class, like an Oura Ring, a Fitbit, something like the Garmin Viva Smart, or that kind of class of Garmin devices, I don't necessarily look at the absolute value of any of those and really trust it or use it, but the relative trends, and over time, those trends data are what's extremely useful and valuable as we start to derive algorithms that can track these kinds of things. And then some of you guys are talking about some of the more expensive Garmins. I think that's where you start to get into the territory of the sensors on those are just higher quality. And so they do start to really provide extra value if that's what you're looking for.
I'm going to keep my loyalties at Garmin, so that's where my accuracy feels. But I would just echo what James said is, everybody has their own algorithms, as Ellen said, but it's really the baseline that I think people need to be more concerned with. Obviously some are more accurate or whatever, but from my opinion, if you start to see trends and things changing, that's when you should be asking questions to your healthcare provider of like, hey, whatever, or AI, in Ellen's case. So
there you go. All right, let's keep going. Let's try another one of these. I think this is unlocking a lot of insights. Okay, my wearable is easy to wear and or use. Like, so general ease of use. A little bit shaky there, James.
So it's less for me. I'll speak more to some of my research participants. So at the Buck Institute for Research on Aging, we do a lot of longevity science and studying aging populations. a ring is not necessarily the best and most universally accessible device if you're over the age of 65. As we get older, we start to develop arthritis in our knuckles. I have a lot of study participants who can't really wear an Oura ring. And so some sort of wrist-worn device like a Whoop or a Garmin or a Fitbit is preferable. I think, Hailey, you mentioned earlier when I first started teaching this course at UT Dallas, and I piloted the idea with a couple grad students of, hey, is this a course that you would find interesting? Would you take this course? One of the first things my students asked me is, well, what color is the ring? And am I allowed to take it off if I, go out or whatever on weekends because it doesn't necessarily match, outfit or whatever? And I'm like, oh, well, I'm an engineer. What's fashion? And so, I think to your point, Hailey, a lot of the wearables have gotten easier in that regard, more aesthetically pleasing and all of that. But purely from the research perspective, we actually think a lot about that, Jared, in terms of how we, because at the end of the day, it doesn't matter what wearable you use if it's not actually worn. And so part of the battle for research in particular, and one of the reasons we have our study participants wear multiple wearables is in case you forgot to charge one or took one off because it was uncomfortable, or you took your Oura ring off because you did strength training and you're going to damage it if you grip a barbell. We're still capturing something.
Great point.
Yeah, I would just, once again, just to kind of lean on some of the design decisions that Garmin makes. I mean, if you have to take off the watch to charge it every night, we don't find that to be very, very good if you want to keep a very good longitudinal data. I mean, a lot can happen in, if you don't track your sleep. I mean, if you're not tracking your sleep, I think you're really missing out on a huge picture of how it can inform you as well as you're doing. Excellent. Thank you.
Love that. Okay. We got a couple more here. The next one is, I understand the data that my wearable provides. I'm a mostly-ish to partial, I would say. So on the Aura side, at least, I'll kick us off on this one. So the app they've added a few new features. Right now, it's not called Health Coach. Oh my gosh, I got to pull it up here real quick. Just the
Health Assistant, I think it is.
Yeah, there's like a health radar on it.
Symptoms radar.
Symptoms radar, and they just announced like a new version of that, so I'm getting tongue-tied about it. But it's worked a couple times particularly well. Once where I did notice, hey, my resting heart rate had climbed significantly over. I mean, it was like a longitudinal. It was like 3-month period. It's like just when it occasionally will point out a single insight like that to me, and like, hey, is there anything going on in your life? And at the time, I just started a new client engagement or something. So I was like, yeah, that makes sense. Different type of stress going on, or at least not having recovery happening in the same way. And then the symptom radar is the one that so far has worked pretty well. Just a couple of it's AI based, natural language. It's able to just at least interpret a little bit better. I've asked it a couple questions of like, you're throwing a lot of numbers at me. What do these mean? And so far, it's done a pretty good job. And I would say that's a journey still, and I'm learning a lot every day. Like 12 months ago, I didn't know the difference between. I didn't know HRV or VO2 max. I'm still kind of learning, like their usefulness in certain aspects of things. So yeah, that's why I'm a here. But definitely, it's a journey, and I feel like the interfaces on that, and then the Apple Watch, again, those are the two main ones I use right now. They've improved a lot over the last couple of years, especially. So they're better at presenting data, the data that I expected to see, and then the data that I didn't expect to see, and trying to at least give a little bit of a nudge to me about, oh, hey, here's something else that you wouldn't have caught otherwise. So I feel like they do a decent job at that, but always room for improvement. Who else has a thought on that? Like on just like you understanding what it's giving you?
I was going to say, I'll just piggyback off of you. I feel the same for Aura. I find it to be super user intuitive, and the advisors feature specifically, I find myself using a lot, especially in the earlier days of, using the ring, to your point, understanding and almost like teaching myself, right? What is all this terminology? And what I enjoy about Aura is how they put it into simple terms, whereas the Apple Watch or the Apple Health platform, I find it to be a little bit clunky. You have to click through the different tabs to find the information you're looking for. And I think the user interface within Aura makes it a little bit more simplistic to understand what data is in there first and foremost, but then to go a little bit further and digest what that data actually means. And then that advisor features there almost as like your hand-holding coach to get to that answer rather than having to take the data and screenshot it and export it into chat. I think out of all of the wearables, like the Aura makes it the most understandable and digestible. And then Apple has, that context, but you got to have a little bit of agency within yourself to go and find out, exactly what those insights mean for you.
Yeah, I was just going to add, one thing that Garmin does, in scores or ratings or numbers, to kind of, like your sleep score, or one thing that we launched that a lot of people like is called body battery. And so really the concept is like your body kind of uncharges throughout the day, and then at night it charges back up. So it's kind of an easy way to think through rest and recovery. But anyway, the real world example of this, my 76-year-old mother-in-law, this would allow us to have some conversations, because she would say, "Hey, Andy, what was your sleep score last night, and what is your body battery?" And then that allowed us to have a conversation. I'm like, I think there's something wrong there, Trish. So she then took that to her healthcare provider and ordered a sleep study, found out she had sleep apnea. And then that turned into a care system, going forward. And that's what we're really excited about, just having that ability to find those changes in the baseline, finding maybe where scores maybe aren't optimizing, and start to ask questions.
Do you want to see it?
Yeah, hold it up again. Hold it up again, Ellen.
So, yeah. Andy, do you want to talk them through it all? So this is my current battery, and then I'll scroll down.
Yeah, so that's just kind of a static, where you're at right now. So that really kind of helps to inform
the daily timeline.
Yeah, and then you can start to see, that orange is stress. So apparently,
cool.
Ellen was probably stressed out when I didn't show up, and she had to put her dog in.
This is my stressor. Was my Summit County bike ride. I did a 2-hour bike ride.
So
I did a 2-hour ride, 1,600 total ascent.
Wow.
10 miles, 123 average BPM, but a lot of that was spent in zone 4. So
now, is that Garmin Connect? Just get very specific on the app.
Yeah, like this.
Correct.
So I downloaded this right before the show. Well, Jared, do you keep going, Andy? Because I do want to build on what Andy said with another piece that I think will tell even more of a story.
Yeah. So what I'd also talk about there is, you had an activity, so it showed what you recharged to overnight, and then you did your activity, and then, there's a function called epoch or post activity. So what you'll actually see is your body is still stressed a little bit because it needs some rest to recover. So your activity there, which I think should be that gap between kind of the two orange pillars there, that was where your activity was. So now you can actually see that your body is now trying to, recover, or it's strained just a little bit because of the activity. So you have some post activity stress there.
Yes, but it is telling me that I still have plenty of energy today. So I said to the agent, I just went in and said to Thomas, I'm on a Wearables podcast and I've told them about you. What would you want me to share about what you've helped me with today? And what were you here to help me with for my health, right? And then also with wearables, and what nutrition suggestion you have for me for the rest of the day. Very succinct summary. So what I helped you with today, I interpreted your Garmin and Aura recovery data in context, not as isolated scores. So this goes back to this whole point of scores, is that it's taking this data and it's building for me. Adjusted the training plan when your travel schedule changed, and today became the only B+A ride opportunity. Tomorrow becomes a B ride before late travel. I added cycle symptoms into the decision-making without overreacting to them, which goes back to Hailey's point about cycling, not bicycling, female cycling. I defined the difference between A, B+, there you go, Zain, B and C rides by purpose, duration, intensity, heart rate zones, terrain, recovery cost, and fueling, which is a big deal, right? I classified today's actual ride afterwards as a high B plus A minus by intensity because although it kind of fit both categories, looked at nutrition before, during, and after and caught the main issue. Protein and sodium were good, but on-bike carbs were too light for that intensity, which probably gets back to Andy's point about recovery. I'm not going to recover as well because I didn't fuel properly. What I'm basically here for is your translation data, your translation layer between wearable data and real life. Or a Garmin can tell you sleep, HRV, temp, like all the things, right? I help turn that into what kind of workout should you do today? How hard should it be? When should you back off? What should you eat? How does travel or your cycle change the plan? And what patterns are emerging over time? The useful part is not AI reads a score. It's the combination: wearables, symptoms, goals, context, your actual behavior. Today was a perfect example. Altitude, cycle symptoms, late travel tomorrow, limited mountain bike ride opportunity, and the actual Garmin ride all mattered. And then it gave me a nutrition plan for the rest of the day. Aim for another 30 to 40 grams of protein, meaningful carbs, rice, potatoes, bread, oats, fruit, pasta, or similar, salt, electrolytes, and fluids. Vegetables are fine, but not as the main carb.
Wow.
Oh, yeah. Okay.
So point being, I think this is so powerful. I think James, I'm so excited to meet you because your lab is a perfect example of where we truly, I get so tired of hearing about how only wealthy, white, fit people use these wearables. And I'm like, maybe that's the case, but they hold such, Andy knows, I am so passionate that these wearables just unlock health at a way that when paired with proper care and knowledge, changes the game on health.
Yeah, that's one of the things I was going to talk about at the end was the democratization that these wearables allow. Everything that you just described and kind of going through with Claude yourself that's exactly some of the stuff that we're developing in my lab is our own AI agents to do this and spinning out a company to, bring this to consumers. And through this company, Avia Biosciences, one of the things that we're doing is a bring your own wearable approach. Because right now, a lot of these different agents are, if you have an Aura, it's great. Or if you have Garmin, you're plugged in. But using some of these AI tools, what we're able to do is just to totally bring your own wearable approach to further democratize it and make it more available and open to anybody who comes.
Hey, Ellen, I was going to ask you, and maybe question, sorry, I'm also hijacking this, but do you think, so much of the behavior change that needs to happen is a personal choice? Do you feel that it's lack of information? So do you feel more motivated for behavior change? I guess maybe is my question, Ellen, knowing all of that instruction.
Yeah, well, it actually, this is why it was so helpful for me to build this the way I wanted it built. I really need somebody to be knowledgeable for me, but not to make me feel judged, but to instead be like this constant source of okay, fine, we just pivoted on a dime. So instead of somebody saying, but Ellen, the plan was that today you were supposed to lift lower body. You didn't fuel for a ride like that, right? But everything changed when I have to go pick my son up. It can't, it's like, well, I can't change that. Instead, I have trained this agent to say, okay, that's fine. I have all the data. Today's your day. This is what you can do to try to make it right. Let's try to flip this around. And that's really important for me. And then also the food. It chides me in the right way. You need to eat. Because I struggle with food noise. I grew up with Kate Moss as my idol, And so for me, it's sweet, I just did a big ride. I'm not going to eat. And I'm going to drop 5 pounds in a hot second. But that's not healthy.
What I'm hearing is, when I take a step back from this and plug it into other conversations that we've had here on the show and just that Zain and I both, try to have with health consumers. And then we turn around and talk with the healthcare industry, right? The healthcare industry taught us to rely on your relationship with the provider. There's an expert who's going to guide you through. Once you need some help, then this is what you do. And in the vast majority of cases, these people do care. Their providers are in the industry for the right reasons. They want to help people. They're well trained. They're great at their job. But look at, if anyone's been paying attention to any of the comments we've shared today, look at how self-guided this journey is. Like, look how much this comes from us individually to say, either I want to prevent things from happening in the first place, or I'm trying to explore how to improve one aspect of my health, something that either I've been diagnosed with or I just don't want to have. So I want to get ahead of that. It's a different mindset. And I do believe that these two things coexist a lot more than we're led to believe. That you can absolutely still have a relationship with a provider, but you can still use all of the AI-based tools and platforms that are available. You can use wearables. You can learn a lot from them. You can be preventing as much as possible, and then when you need help, you have human beings as part of that relationship. That's my paradigm, my hypothesis, at the very least, that these two worlds can coexist still, and that's an even greater unlock as we see what's possible there. So that's where I'm coming from. Would love anyone else just to chime in with a final thought or two if you have.
Sure, maybe I'll go first. I would say that in general, the hardware for some of these wearables have come a really long way, especially the upper end of the market. Like I mentioned, some of Garmin's kind of premier products have been outstanding for years. And I think the technology is getting to the point where a lot of some of the kind of entry-level devices that are more, $300, $400 are getting to the point where they are comparable on some of that. We've kind of talked about AI here. I think there's huge opportunity in the future with that, but with that comes major privacy concerns, especially with people inputting their own personal health data and PII into Claude and Anthropic and Gemini and ChatGPT, whatever your tool of choice is. I think there's big time concerns and there's discussions that we should be having on kind of the ethical side of some of those kinds of things. But in general, I would say that the traditional healthcare model relies on very episodic, highly spaced out, quantized snapshots of a person's health inside of a clinic specifically. And wearables give us that missing piece to actually, look at all of the data in between. Andy shared that anecdote with us about being able to have that data in between can actually be used to diagnose clinical maladies and disease and these kinds of things. And so when we start to pair the continuous data stream with rigorous data science and some of the biochemical measurements, this is a lot of what my research lab does. I think that's where, that next step is really going, is once we pair a wearable with something like Function Health. And we've seen all of the wearable companies start to work with Quest and LabCorp to kind of bring in lab data and all of that. I think that's where we really get to the point of tomorrow's medicine, of making it N of one, more preventative, and having that continuous care model that eliminates the episodic nature of the current sick care model.
Well, and so that's where I will bridge to say that's why we need to have a new parallel economy. And we need to unlock some of what we force downstream, right? We already know from an actuarial risk perspective that 3/4 of people are going to end up with chronic disease. We have to fund that. And so people, basically all of their healthcare dollars are pushed and put with that assumption of that downstream. And so what we have to do is start to break that apart and ensure what's actually insurable, instead of trying to take more upstream and force it into the insurance model. Once we do that and we start insuring what's insurable and premiums become actual insurance, now we have premium dollars to be able to allocate to different types of care delivery, like James, you're talking about, right? So that it's not this constant push-pull of like, well, prevention needs to be covered. We should be covering this. We should be paying for that. Or I don't have money. I can't pay for it. I have to wait until I get sick. And private industry we have a tremendous opportunity here to restructure ourselves. And I'm very passionate about that, which is why I think this discussion is so imperative, because it demonstrates, we only put about 35% of people into the healthcare system. When you look at the healthcare risk pyramid, at most it touches 35%. 65% of us are out there just hoping we don't get sick. And we can do a better job than that.
I really appreciate this panel. Love this format. I think this was tremendous. Thank you all for participating, for sharing your experiences. And let's keep this conversation going. Let's keep you all part of the healthcare app community, and and invite us to keep these things going. So again, thanks for joining us today.
Thank you.
Thank
you.
Sure.